Shimona.
Hi, Dr. Bastos.
Hi. Come and have a seat over here if you would.
Okay, brilliant.
This is Jade Stevenson, who's interviewing with me. I'm Rob Ross-Russell. I'm the Director of Studies here in Peterhouse, and this is your first interview, I think, isn't it?
It is, yes.
It is, okay. So you're going to have a series of interviews today, and each interview will be with two people, and what we're going to do is run through, it's going to be mostly sciencey questions right the way through, and at the end of it you'll get a chance to ask us a question if you wish to, but you certainly don't need to. And then we'll that'll be the end of it, and we will be in touch with you in due course.
Okay,
is that right?
Yes,
okay.
That's wonderful.
So here the interviewer does a nice job of putting the candidate at ease. He explains exactly what's going to be happening on the day and exactly what to expect from this particular interview. Now you can see from the setting that it's quite laid back and casual, and this is often how it is. Colleges will have these older rooms with maybe some lamps in, some old nice sofas, some nice chairs, maybe an old desk in the corner or something like that. By all means, it's not like an exam, it's like a casual conversation with a friend. So treat it as such, be in your element, be comfortable, and try and express yourself as though you were talking to maybe a friend, but in a slightly more professional way.
Now, I think that you had one of the cases to have a look at, is that right?
Yes, I did.
So we've given you a case, you've had half an hour with computer, with phone, with internet access to look through the data that we've given you, and there's a series of questions. Which case did you get?
So I had the case with Jack, who has cystic fibrosis.
Okay. And what I'd like to do is we've given you a series of questions. I'd like to pick on question one, which was about carriage. So I asked you about Jack's brother, who does not have cystic fibrosis, and the risks he has of having a child in the future with cystic fibrosis. So how did you get on with that?
Okay, so the question says that if the carriage rate for the mutation general population is 1 in 25, what are the risks of his brother having a child with CF in the future? So Jack himself has a 1 in 2 chance of having cystic fibrosis, and his partner will have a 1 in 25 chance, because that's what it says in the question. So, Jack has cystic fibrosis, sorry.
His brother.
So his brother would have 2 chances. And so they have a child, so that would be a 1 in 50 chance, and there's a 1 in 4 chance of this child having cystic fibrosis, so 1 over 50 times 1 over 4, 1
Which
over
is
200.
Okay. So you're saying that the chances of them both being carriers are 1 in 50, and therefore the chance of having a baby, well done, is only a quarter of that, because there's only a 1 in 4 chance. So computation is correct, but the answer is wrong, because one of those figures is incorrect. So let's just go backwards and think about that. So talk me through the various assumptions you made.
So here the candidate does a nice job of talking through her thought process. She explains what the natural frequency of the carrier rate for this mutation is in the population, and then goes on to use that in conjunction with the information that she knows about Jack's brother in order to work out what's the probability of these two meeting and having a baby, and then using the 1 in quarter probability, which is the probability of having a homozygous recessive offspring from 2 carriers, using that with the information that she calculated before to calculate the overall probability of 1 in 200. Now in this case the interviewer says that answer is wrong, although the computation, the process, has been correct. Therefore it's just one of the numbers that is wrong, and asks the candidate to go back and think about it from the start again. Now in this case, even though it's prompted by the interviewer, it's a really good technique to use and pick up on. If you find in your interview that you've gone wrong, take a step back, go back to the beginning and analyse the assumptions that you've made to get to that answer. Maybe one of the figures along the way went wrong. Now in this case, the interviewer does throw some useful hints in there. So for example, when the candidate said about the quarter chance of the offspring being affected, the interviewer said, yes, well done, that would be a quarter. So that already kind of tells us that quarter probability is probably the correct one. On the other hand, the candidate will go on to say about that 1 in 25 chance being mentioned in the paper, and again the interviewer accepts a little later on that yes, that is also true. So it's very clear that this original probability of 1/2 of Jack's brother being a carrier is the incorrect one. So working a bit with the interviewer, listening to what they're saying, and using that information to frame how you're thinking is a really good technique to have. Now you'll also notice on the more subtle side of things that the interviewer didn't jump in when the candidate said the wrong name of the question. So we're talking about Jack's brother. Originally the candidate was saying things about Jack. Now in this case the interviewer clearly knows where she's going with this information. It clearly knows that it's a slip of the tongue, so it doesn't bother to step in. And that's really useful to know because it's not like the interviewers are trying to catch you out and be like, aha, you said the wrong thing. What they care about is your thought process. It's only when your words get in the way of that thought process and it starts to sound a little bit muddled that the interviewer will jump in. So in this case, take a positive from it in that the interviewer is trying to guide you, and then if you want to improve your technique and you get something wrong, go back and analyse it from the start.
Okay, so it says in the question that the carriage rate is 1 in 25.
Correct. So that's fixed.
Fine.
Yep.
Then I've assumed that the brother has a 1 in 2 chance of having cystic fibrosis.
So have a little think about that. Wow.
If you look at the body language here, it's very clear that this is the wrong number and the candidate should dig a bit deeper on this one. The candidate slows a little bit, seems a bit hesitant because she herself thinks that this is the wrong number. If you look at the interviewer's body language, he's leaning in, he's raising his eyebrows and seems to be looking very suspicious. Now this is telling the candidate, look, I think that you should look a bit more closely at this number. It's important that you see these cues and that you realise where you're going wrong and engage in the conversation with the interviewer. If you've got your head buried in your books, trying to work things out, getting more and more stressed, all you're going to do is miss all of these cues that are trying to point you in the right direction. So take your time, talk to the interviewer in front of you and try and get a gauge of the problem that you're solving together.
Oh, I see. So he has a 12-year-old sister who is also affected.
So
and a 10-year-old brother who does not have the disease.
So what do we know about the brother? What's the genetic makeup of the brother?
So
if you use your big X's and little X's or big C's and little C's, what do you got?
So cystic fibrosis is a recessive.
Correct.
Need a recessive gene, and so the brother is going to be a carrier.
So he could be a carrier,
or he could have none of the cystic fibrosis.
So in this case, the interviewer is trying to bring the candidate back to what she should already know about genetics. So he's asking the candidate to think in terms of maybe big X, or big C, little c, whatever framework she wants to use, but something that she'll be familiar with from school. This is a really common technique in Oxbridge interviews. They'll try and lead you into something that you don't maybe know, trying to get you to think through a problem, and if you start to stumble, they'll maybe take a step back and try and look for another area of the topic that you're a bit more confident on in order to again lead you into that unknown step by step, trying to get you to think through the problem. In this case, the candidate got something wrong, they're analysing this number together, the interviewer takes her back to her knowledge about genetic crosses, and then is now pointing in the direction and thinking about the probabilities of those crosses. So all in all, he's trying to pave step by step the way to the correct answer, and it's all about how the candidate responds and talks through her process.
So let's think about the chances of each of those. What are the options that are open to him?
Okay, so he could either be, what letter should we say? C. Big
C,
C, little
fine.
c.
Okay, big C, little c.
So he could either be big C, little c, or big C, big c.
Yeah. And are they divided 50-50? Because you said he had a 50% chance. Do you think that's right?
No, that's not right. No,
because?
I say that because it could either be big C, little c, big C, or big C, big C.
Okay.
You can see here the interviewer is very pleased with this answer. Initially, he questions and sits back and says, "Do you think that's right?" This is a very leading question. Clearly, he wants the answer no. But the reasoning and the reason he's asked this question is because he wants to know why that's wrong. Now, in this case, the candidate clocks onto the fact that it could be big C, little c, or little c, big C. And therefore there are 3 different genomes possible, 2 of which lead to this Jack's brother being a carrier. So in this case, the interviewer is really pleased that the candidate has got through to the answer, and you can see here the candidate is engaging, she's enthusiastic to be there, and this is really good interview practice in process.
Big C, big C.
Okay.
So he would have a 3 and 4. Oh.
3 and 4? There's only 3 options there.
I see, so it would be the same the other way around. Okay,
It'd
so
be-
it'd be 2 and 3.
2 and 3, because we know he's not got CF. So he's got a
Mhm.
2 and 3 chance.
So that last little bit, you can see how the interviewer's body language changed from being very pleased with the candidate to suddenly there's something wrong, we need to just correct that, iron out that little kink. Now in this case, the candidate probably got a bit carried away, trying to fit all of the pieces of the puzzle all at once. She probably went back on her knowledge of genetic crosses from GCSE and A-level, and actually thought, okay, there's 4 offspring, 3 of which have maybe homozygous dominant, and these 2 carriers which are either little c big C or big C little c. So therefore it's 3 out of the 4, and kind of went away with that. Now that's not the question that's being asked, and of course we're asking about what's the probability of Jack's brother being a carrier. So it's 2 out of those 3 genotypes that she mentioned. We already know that he doesn't have the condition, so we don't even need to worry about the little c genotype. That shouldn't even be in the denominator. So that's why this is a 2 out of 3. And what I would advise this candidate in this situation is just take a little bit more time. Remember that it's not a race, and it's particularly tempting at the end to try and piece everything together and do the big magical show, ta-da moment at the end. But what's more important is that you take your time, that you make sure what you're saying is accurate, and that you're responding and carrying along the same thought process. Because it'd be a shame to throw it all away at the end due to a silly sort of quick mistake.
So do you want to recalculate your figures now?
Okay, so if he has the brother has a 2 in 3 chance of having cystic fibrosis, and his partner has a 1 in 25 chance, then that would be 2 in 75.
Yeah, okay. And then
And then, what are the risks of his brother having a child with CF in the future? So then we have the 1 in 4
correct.
coming in.
So pop that in.
So that will be 1 over 150.
Spot on. That's the right answer. Well done.
So here the interviewer is quite pleased that we've got to the end, and you could see from her calculations that the interviewer is actually quite pleased with the fact that she's taking her time. She clicks the pen, starts writing away, making sure that she's not making any mistakes. Meanwhile, the interviewer's got a big smile on his face because this is the moment that they live for. They want to be teaching you, guiding you through a problem, and a candidate who realises at the end, of course, that's how it works, clicks their pen, starts writing away and delivers a good answer at the end to round off this example. That really shows that the teaching has worked, and this is a candidate who will be responsive to the Oxbridge style of teaching. So overall, that's what they're looking at. That's the money shot, if you like, of this interview. Now, the interviewer now at this stage is about to move on to a different topic, and that's just useful because it allows the interviewer to explore a different set of skills that this candidate might have. It allows the candidate to show off a different aspect of her portfolio, if you like. And as well, if the candidate had messed up on the previous section, it offers a fresh start in order to allow everyone to relax a bit more and tackle a new problem in front of you.
Okay. I'd like to move to something else now. We've got, I've got here a paper. I'm not looking for a detailed analysis. This is a paper by a lady called Ingrid Wolf. It's a paper published a few years ago now. And in it there's a table down here. So this is a table of mortality. So this is the percentage of deaths per 100,000 children. And this is different countries across here, and then there's different axes. One is mortality, which is the red dots, which is what I want to look at. So I'd like you to just spend a moment looking at that, and then we'll just talk our way through what that might mean and what we might do about it. So what's the first thing you notice?
Okay, so I can see that compared to all of the other European countries, the UK's mortality rate for children aged 0 to 15 with asthma is much, much higher. I mean,
Sort of magnitude higher?
5 times higher
Yeah.
than the highest country, which is Spain.
Which is Spain. So the UK seems to have a mortality in that age group from asthma that is 5 times that in the rest of Europe.
Mm-hmm.
So here the candidate does a good job. She describes what she is seeing in front of her with very precise language. We're talking about mortality in 0 to 15-year-olds with asthma. That language is very precise. It tells the interviewer that we're talking very scientifically about what we're seeing, and that this candidate is thinking in an analytical and logical way. That's far better than using vague terms like it, or this, or that. For example, a candidate might say, well, it looks like it is much bigger than compared to Spain. In this case, that tells us no information. The candidate takes her time here and explains exactly what she's talking about. Now, it would have been nice if she had quantified that difference without the interviewer prompting, but it's not a big deal. The interviewer prompts, we discuss it, it's 5 times bigger, and it's just a little stepping stone to the next part of the interview. But it would have been nice, wherever you can, to quantify changes in the graphs that you can see in front of you. For example, if you see a graph that's increasing steadily and then starts to plateau, at what numbers does it sort of start to plateau? That'd be the kind of thing that I'd be looking for.
Why might that be? And what I'd like to do is think in broad terms. So why might that not be correct? But also, why might it be correct? And what might we do to think about that?
I mean, a reason why it could not be correct is if there's some kind of recording error. So perhaps there's more surveillance in England for asthma. I don't know. Perhaps the NHS monitors it more regularly.
Okay. So we might monitor it differently. What particular aspect of monitoring? Where do you think that number comes from?
Probably GPs, highly likely.
Well, where's that number come from?
The mortality.
Yes.
Hospitals.
Yes, I suppose so. Death certificates.
Oh, okay.
So
yes.
so it's going to depend on the death certificate, I think, is
Okay.
going to be where it comes from. So might that be different in different countries?
It could be, but then given that all of these countries are, developed countries in Europe, I don't know, that's probably not likely. They probably have similar standards.
So here there's a discussion about why this might be the case, why are these numbers not correct. And the candidate takes a good hint from the interviewer exploring that side of the equation first. She offers a useful and valid explanation. Maybe there's some differences in the recording or surveillance or monitoring of asthma mortality in these different countries. Now the interviewer wants to encourage that a bit more, start to think about it a bit more deeply. So he asks her a follow-up question. What exactly do you think this is? Where do these numbers come from? How are we actually recording deaths? In this case, it's to do with death certificates. Now, again, it's not important that the candidate knows that. The interviewer is just adding it in as a follow-up question just to really get to the bottom of what the candidate knows. It's not the most important part of this interview. What is important is that the candidate is speculating, using creativity, imagination to think outside the box and think about what might be the explanations that underlie the data in front of her. That's what's important here, not the death certificate part.
So so that's the numerator. What about the denominator? Might that be different in different countries?
Well, the denominator is per 100,000.
So that's per 100,000 asthmatics?
Just children.
Okay, children. So that's not really. So I thought at first this might be asthmatics, but if it's children, there's not going to be a change. All right.
So here it's actually interesting, the interviewer slips up and forgets that it's per 100,000 children rather than per 100,000 asthmatics. Now what he might have been saying was that if it wasn't exactly clear whether this is per 100,000 children or asthmatics, that obviously changes whether we're looking at what kind of population we're looking at. So as a result, that might change the data in front of us if it's been recorded in these different sort of proportions in different countries. Now in this case, the paper clearly states that it's per 100,000 children, so that's not a valid concern here. And it just goes to show that the interviewers are human too. Everyone can make mistakes, everyone can seem to think something and actually it's a different case. So it's much more of a conversation as a result of this. The interviewers aren't meant to be scary, they're meant to be friendly, and they're world-leading academics at the end of the day. But they are human.
So just to pursue that just a little bit further,
Okay.
I'm going to make you Minister of Health for the UK, and I'm going to slap that on your table on day one and say, you've got to sort this, Shumina.
Okay.
What are we going to try and do about it? How are we going to go about fixing that sort of a problem?
I think first of all we'd have to address it at a primary care level.
Okay, good.
So at the level of the community. So probably especially with children, kind of standard checks in schools. So, you know, how you would have kind of measles vaccinations, like given to all children of a certain age, in a similar way, perhaps testing for asthma, and diagnosing it at an early age and making sure these children have kind of appropriate drugs given to them, salbutamol, that kind of thing, or at least are on the record for having asthma and therefore are monitored in some kind of way.
Good.
So at the primary level. Also, well, we're looking at mortality here, so it's not just morbidity, it is mortality. So we need to address it at the level of where this is happening. So in the hospitals, so why are we having such a high number of, well, high proportion of deaths? Perhaps it's something to do with the protocol, with our plan of action when an asthmatic child comes in. So we would have to review that and perhaps compare it to these other countries where the mortality rate is lower.
Yeah.
So here the candidate is spitballing quite a few good ideas. There's a few that come in at the start about GPs and making sure that we're monitoring these asthmatics appropriately. The candidate then gets a rush of inspiration and starts talking about the hospitals. And actually maybe it's to do with the actual treatment of these asthmatics when they're having a severe attack. And maybe we need to adjust the protocol because it's not saving enough lives. Now, what would have been nicer if she's a bit more precise, a bit more tight on that language at the end bit. She talks about, maybe we could change the protocol, but it would have been nicer to say maybe we could change the protocol to ensure that people know what they're doing when they're dealing with an asthma attack, and therefore there are less likely to be errors made and therefore less mortality as a result. Just a bit clearer on that link between how she's thinking and what she's trying to get to in terms of the objectives here. But nonetheless, a good few ideas. Now, what would be a better way to structure this is to think in terms of primary, secondary and tertiary prevention. So primary prevention, stopping people from getting asthma in the first place. Secondary prevention, when people have got asthma, stopping them from getting those asthma attacks. And tertiary, what she's going to speak about just before I stop this, is once they have an attack, how can we best minimise the damage from that attack by devising better protocols, better management plans and better doses of our drugs.
Good. No, I think it's very good. One other aspect that's been picked up on is who is the person who sees the sick child first. And we have a general practitioner system, and other countries have paediatricians who see their children. And one of the suggestions of many has been that might be a factor as well. That's very, very good. Okay.
So that rounds up this interview, and I think overall this candidate was actually a very strong candidate. She's actually someone that I know from the course, so it shows you what a small world Cambridge medical students are. Now, in this case, the candidate does a really good job of explaining the genetics in the first part, using her knowledge and talking through a problem when she gets it wrong. It's not important that she got the calculation wrong. What was important is she was able to identify what was wrong about the calculation, make amends, and carry it on through carefully and logically to the correct answer. That is what they want to see in these Cambridge interviews. In the second half, she was very precise on the language at the start. It would have been nicer if she was a bit more precise on the language at the end, but overall, it was a good job of spitting out ideas. Maybe it could be this, perhaps it could be that. That's what they want to see in terms of creativity and imagination. They don't want someone who sits there in silence and really can't think of anything. So if you're at a loss for words, try to take a moment to yourself, order your thoughts, maybe come up with a bit of a structure, like that primary, secondary, tertiary structure in terms of preventing disease, and then talk through it with the interviewer in front of you. That would be the ideal approach. But overall, this candidate was a strong candidate, and I'm not surprised that she got a place in Cambridge.